I'm Dr. Lynne Yong, the resident clinical psychologist at Penang Adventist Hospital. Depression, actually, when we talk about depression, we're talking about major depression, a major depressive disorder. And that is an illness which involves your body, your thoughts, and what people know, your emotions, right? So we need to understand that depression is not a sign of personal weakness. A lot of people think that it is something that you can just snap out of. Okay? It is not. It is an illness, just like you don't snap out of a flu, right? And if it is not treated, it can last for months or years. So people need to understand that it can be chronic and it can be progressive. So over time, what happens is the episodes can be less and less related to stresses or the environment or whatever not. It can just happen at any time if it is not treated. So how we look at it is it comes in episodes. It's not that you're depressed all the time. It can come in like episodes of 2 weeks or more. Okay. So if we don't get it treated, it'll keep coming back. So in essence, this is an illness, and why it happens is for a lot of people is because we have stress. You're alive, you get stressed. And sometimes when you get overwhelmed, psychological stresses happens, and then we find that our life has no meaning. So what can happen is that we can fall into a depressive episode. But for some other people, there is a physiological explanation. We haven't really found like a depression marker, but they are just biologically predisposed to get this disorder. I think what people need to understand is that this is treatable. In 80% of the cases, we can treat depression no matter how severe it is. Okay? The problem is, especially within the Asian population or Asian culture, the stigma is so strong that people don't come to get treatment until they are extremely, extremely severe. And then it takes a much longer time to get them back to health. Well, the most obvious one is you just feel sad. And this is not just your normal sadness, right? This is when you feel so low. You feel very low about yourself. And there's this sense of emptiness about you. Okay, like I said just now, it's a sense like you have no meaning in life, right? And aside from that, somehow you don't find any pleasure in life. Okay, so even if suddenly you win like the lottery, also you won't feel happy, right? So this is what we call anhedonia. You just feel no pleasure whatsoever, no matter all the things that you used to enjoy. Other symptoms will be like you can get very, very agitated, this sense of restlessness in you, okay? In terms of work, you have problems concentrating, okay? Your sleep is affected, and sleep can be both ends. Either you can't sleep at all, or you sleep like 20 hours a day. So anything extreme, you want to be careful. Okay? And your appetite also, anything on the extreme end, you want to be careful. Either you have absolutely no appetite, you don't eat, you just don't feel like eating, or you're eating all the time because you're trying to fill that emptiness within you, right? Energy, usually very, very low. You find that you're just dragging yourself every day, everywhere, okay? And the more damaging part is the cognitive part, the thinking part, whereby you start to think as if you're being punished for something, God is punishing you or whatever not. You think that you are so worthless, you are someone who is completely useless, okay? There's no future for you, you feel completely hopeless, okay? And you can't do anything to help yourself. So these are the symptoms of depression in terms of how we think. In the Asian population, what we find is that a lot of times when they come in, they don't complain about the mood so much or the thinking part so much. They usually complain more about physical symptoms. Okay? Okay, the usual one that we find, people complain about aches and pains, they can't sleep, Asians usually complain about these type of problems, okay, body problems. But these problems, if you look or if you chat with them, you find that they don't really respond to treatment. Like if you have lots of headache, you take medication for your headache, usually your headache resolves. But for them, they take all sorts of stuff and it doesn't go away. So then you want to think about, what else is going on, right? And the worst thing about depression is they start thinking about ending it all. Since you find there's no point to live, right? So what do? So they think that if I die, I'll be less burden to my family, or if I die, I can escape the suffering that I'm in. So they start to think about dying or wanting to die. Ending their life is a very, very severe symptom of depression. Well, generally, you would see a mental health specialist, which will comprise of a psychiatrist usually. People usually mixed up, what is a psychologist, what is a psychiatrist? A psychiatrist is a medical doctor that specializes in mental illness. They specialize in mental illness, okay? A psychologist like myself, we are not medical doctors, so we do not give medication, okay? We are trained from a graduate level, academically, right? And all of us are trained to assess the signs and symptoms of depression or any other mental illness. Okay, so how we do it is we talk to you. Okay, we check different things, how you're functioning, how you're thinking, things like that. And from that, there's a cluster of symptoms we look at, and we compare it to your previous functioning. Okay. So there need to be a significant shift from how you're functioning before to how you're not functioning now, right? And we also look at areas that cause you distress. So once we have all this and we determine that it is at least 2 weeks or more, then only we can determine whether you're having a major depressive episode. First thing is get help. And when we say get help, where do you get help? You can go to any hospital that has a mental health treatment facility, any hospital that has psychiatrists or clinical psychologists, okay? That is if your symptom is really, really disturbing and you really cannot function. You can also go to counselors. If you're distressed about something specific, go seek counseling. Or even when you come to a clinical psychologist, we do talk therapy. We try to figure out what is going on, how you're thinking about it, that's affecting how you're feeling about it. What are you doing physically at home that is actually maintaining this type of depressive mood that you're in. Okay? So if you see a psychiatrist, they will usually if they diagnose you, they will usually prescribe medication. Now, it is very important when you see a psychiatrist, you need to work closely with your psychiatrist. They don't live with you, they cannot read your mind. Okay? So you need to tell them what is going on with you, how the medication is helping you or not helping you, what is happening with that. You work together with them. So medication for depression, it takes a while for it to actually kick in. So a lot of people make this mistake that once you take medication 3 days, you don't feel better, it doesn't work. But the medication doesn't work like this. It takes a while before it can actually start working. So you need to talk and you need to learn about what's happening with you with your psychiatrist. Okay? And whatever worries you have, you talk it over. Sometimes seeing a GP or any of your physicians, they are also trained to kind of pick up the easy signs. Okay? Some of them actually do treat with medication with that. If it gets more complicated, they will usually refer to a psychiatrist. So the actual answer is yes and no. Okay. You can prevent depression if you know what tends to trigger you. So you learn coping mechanism, you learn stress management and all these things so that you don't fall into that loop of negative thinking that eventually pulls you down. So that is situationally induced type of depression that once you are more aware of it, you can kind of mitigate lah. No, for people who tend to have a biological predisposition to getting depression, means it's chemical imbalance in the brain. You can't do anything about it, but no matter what the situation is, you can help yourself because it still can be treated. Okay? So it's very important to manage your stress, manage your expectations, work with your doctor, take your medication, and also for family members to learn that you don't need to suffer alone. Okay? Get support. When people are depressed, they usually want to keep to themselves. Okay? And that is not helpful. So when people are depressed, the best thing you can do is get support around you. Not that you're burdening people. People care. Let them care for you. First thing, when you start to feel kind of down, talk to someone. Get someone else's perspective about what is happening with you. Okay? Sometimes talking about it can relieve some of the stress that you feel. I mean, how many of you have gone through periods when you're kind of down and stuff, and then you talk to a friend or you cry to a friend and then you feel better, right? So don't be alone, talk to someone. If you don't have anyone that you trust, unfortunately some people have that situation, there are helplines. Call up, they are free. So like Befriend Us or Mitra Line or Agape Counseling, things like this. Call them up. Get a different perspective in terms of how you're thinking about your situation. If things are really bad, or not really bad lah, if things tends to be more distressing for you, go to a hospital. It doesn't mean that you definitely have to start medication or you definitely have to start treatment, whatever not. Just get a consult. Okay? Learn what is happening. Most important thing, empower yourself with knowledge. However, please be careful. No Dr. Googles. We have so many people who get into more trouble because they're trying to be doctor to themselves and take in information that's not valid. Educate yourself, but from correct sources. Okay? Most importantly, don't be alone in this. For the public, I think people need to understand there is no health without mental health, right? We need to treat mental illness as seriously as physical illness. There's no difference. So please fight the stigma. It's not about weakness. It's not about someone cannot cope, whatever. It's not about any of those stuff. It is an illness like any other illness. Nobody asks for it. Nobody wants to be depressed. Okay? So if you get treatment early, you figure out something's not right with you, go get a consult, get treatment early so that you can recover faster. Okay? That is very important. And depression is like a common cold of mental illnesses. And what does that mean? It means that it is so common, it affects nearly 16 to 24% of the world's population. So think about it. Out of 100 people, 16 to 24 of them is going to get depression in their lifetime. That's a lot. So in terms of economic burden, depression has overtaken heart disease. You know? So this is something serious. We need to take this seriously. It can be treated. You are not alone. Fight the stigma.